There is a very good chance that everyone knows someone that has been affected by breast cancer.
I remember at the age of 23, I had graduated from college. I just went to go get a regular checkup. And the doctor there, she was minority, and she was like, do you ever check your breast? Which I did it, if I'm honest, I did it, you know. I'm 23 years old, you're not really checking your breast. And so she asked because she checked my breast. And she felt around, and she found a lump. My very first biopsy at the age of 23 years old. I have a strong family history, very, very strong family history. I have a great uncle who had breast cancer. I have 2 maternal aunts who have breast cancer, and I have 2 maternal cousins who have breast cancer. And my mom also has cervical cancer. So cancer is just like it runs rapid in our family. I was informed that I have the BRCA2 gene at the age of 28. And so from then I had to have regular checkups every 6 months. One would be an ultrasound, next would be a mammogram, and that was like, back and forth. And also MRIs, have those regularly as well.
Somebody with BRCA1 or BRCA2 mutations, breast cancer screening should start at an earlier age 35 or 5 years younger than the closest family member that was diagnosed with breast or ovarian cancer. BRCA1, the breast cancer risk is somewhere between 55 and 72%. For BRCA2, that number is about 45 to 69%. And then for ovarian cancer, the lifetime risk for BRCA1 is about 39 to 42%, and then with BRCA2 it's an 11 to 17% risk. So these risks are much, much higher than the risks for non-BRCA mutated individuals.
I had an MRI done in May, and they told me to come back because they found something, which is typical sometimes, especially with me, I have heavier breasts. So I went and get a biopsy, got a biopsy done. And that was on a Thursday, and that Monday they called me to tell me I had breast cancer.
When a patient first comes to me with a diagnosis of breast cancer, they are usually referred to me from the breast surgeon who is taking care of them in regards to the cancer and is going to be performing the mastectomy. So that surgeon sends them to me to discuss breast reconstruction. Breast reconstruction options include using an implant, either a silicone or saline implant, using the patient's own tissue. A lot of times from the belly is the most common area that we take that tissue from, the skin and the fat off the lower abdomen. We also can sometimes do breast reconstruction where we use the patient's own breast tissue and rearrange it. So we're only taking off part of their breast during a partial mastectomy and rearranging their own tissue to keep as much of their breast as possible. So usually the morning of surgery for the patient, they get there a couple hours before surgery is going to start.
The morning of August 2nd was terrifying for me. At the age of 37, I never had any surgery in my life. I had invited a few people to come for a prayer circle because I didn't know what to expect, never having surgery. My family came in, my church family came in, some sorority sisters came in, and I just started crying because I had that much support at that early in the morning. My pastor prayed, and my cousin sang, and it was a beautiful thing to see everyone there who had pink on and supported me, and it was awesome. I felt a sense of calmness come over me because I wasn't alone.
Nursing will come in and get the patient's vitals and put in IVs, get them in a gown for prepping them for the surgeons to come in and talk to them. The general surgeon or the breast surgeon doing the mastectomy will come and usually mark the patient, talk to the patient about the plan for the day. In Erica's case, she was having an oncoplastic breast reduction along with the partial mastectomy. That was her choice for breast reconstruction. And what that means is a patient who has large breasts to begin with, who maybe has always kind of thought about having a breast reduction because the breasts give them back pain, neck pain, shoulder pain, but maybe hasn't moved forward with it when they have a situation where they have cancer in the breast, it's an option for them to consider doing a reduction at the same time as they have the partial mastectomy, so that the tissue of the partial mastectomy is removed and we can do a matching amount of tissue removed on the opposite breast to make the two breasts match now in size. And the patient can actually also have even more tissue removed if they want to even be smaller than that. That's an option as well. So on the morning of surgery for her, I went in to mark her for that breast reduction, because the marking the patient beforehand is very important to get symmetry as much as possible. The marking also allowed Dr. Ashcroft, her breast surgeon, to know what incisions she could make to go towards to do the partial mastectomy. Anesthesia would come and see the patient to talk to them about the anesthesia and what's involved with that.
After all the doctors had came by to see me, it was now showtime. And so I had to say farewell to my family. So I hugged my mom and my aunts, and I was taken back to the operation room to begin the procedure.
The general surgeon may take 2 to 4 hours depending on the procedure, and then when I come in a case like Erica's, it took me about 2.5, 3 hours to perform the reduction after the mastectomy was performed. And then once I finish with surgery, I go out and talk to the family members, tell them how surgery went, explain any details that are important for them to know about recovery, about follow-up. Yeah, we talk about best ways to sleep after surgery. We talk about restrictions for activity. We talk about what they can do as far as range of motion with their arms, when they can shower, what dressing or bra they should be wearing after surgery.
I didn't experience any pain, more discomfort. So I didn't take the prescribed medicines. Actually, I had ibuprofen and Tylenol, and that worked. My mom was a big help, but she's been at St. John's Hospital for 47 years, so she knows the ins and outs. She's seen all of this. She was on it the entire time. So it wasn't no laying around. It wasn't any of that. I was up walking the next day. My mom has been my constant support, and I really appreciate her because, she understood what was going on. She dealt with patients like this. A little different now because it's her daughter, of course, but she didn't let up. Like went from walking 5 laps around the house to walking 10 laps around the house. 6 days after my surgery, I saw Dr. Summer. She wanted to check out my bandages to see how they were, to see how my stitches and things were, and then come back so that she could remove those. After that, I saw Dr. Ashcroft, who came in with good news. And she came in and told me that they had removed all of my cancer and that my lymph nodes were clear. I was extremely nervous walking to the fitting. I was like, Maria, what have you gotten me into? I was just nervous. I didn't know what I was walking into. I knew it was something positive, but I was really nervous. I went in there, I sat down, and because we all had different shifts, so when you go to New York Fashion Week, you have your practice, and there's a bunch of people, like 30 models this year, and they put you in shifts, and so you come at the time of your shift to model. The other model that was with me, Susan, she had an earlier shift than me, so I came to watch and see how everything went down. So I was watching at first, and then Lolita took me outside to talk to me. And I'll never forget this because me and her had a moment. She said, I don't know what it feels to have breast cancer, but I know what it feels like to have a son to be murdered. And then she talked about her storm. And I think at that moment I broke down because I always talked about like there being a rainbow after every storm. And I was like, how does she know about my analogy of a storm? And she doesn't even know me, right? And so she was like, she told me this story about how she was driving through a storm and she was so nervous because she's never been through a storm like that powerful.
And in that moment, I literally heard and felt God say, I got you. Because I couldn't get over it. There's nothing I could do. And I found myself, before I knew it, I was sitting back in my seat. And I'm just driving the car, and now my panic turned to praise. And I'm like, thank you, God. Thank you for this storm. Like, thank you, like, for everything. And as I'm feeling this, I drove right out of it.
And I think at that moment, I was like, whoa, like, I'm going to get out of my storm. Like, I'm getting out of my storm. And for her to not even know me and to offer that analogy about, you know, what she had just been through in this storm, wanted to get out. And here I am in this storm, trying to get out my storm. It helped me out in a way that she doesn't even realize what that did for me. I think that sparked the motivation I needed at that point to do what I had to do to get the job done. Because in this, she also said, she saw me. She said, you're special. I don't even know you, but you're special. And she said, I see you. And she said, from one black queen to another, I see you. And she said, I need you to go out there. I need you to go out there. I need you to kill it. And she said, I give it all you got. And she said, leave whatever is bothering you, leave that all on the stage and get through your storm. And at that moment, it was just like, let's go. Like, I was ready to go after that. I was ready to go. Because, like I said, she didn't know me. Dana was amazing. And if I can say this, Dana is like a badass. She has a vision. You go in there and she's like, hey, how you doing? She hugs you. She embraces you. She gives you like the biggest hug. And like that makes you feel like good as well because she doesn't know you. And then we get to work. You know, she gives you outfits. She gives you shoes. She's like, okay, does that work? Does that not work? And she just goes to work. And it's like, her visions are just incredible. Like, you know, the fact that she even has this designer line for people who have had breast cancer is amazing in itself. But meeting her was like the icing on the cake because I was able to meet a designer. She actually like dressed me and, you know, saw the look that she wanted, and it was incredible. The day of, it was jitters, nerve-wracking again, because practicing is one thing, but actually going to the location and seeing the runway, seeing everything set up, like it was showtime. And then you go downstairs, and this is like TV, movie, how the production works. They have a profile of you on a paper. They have the look they want. They have the makeup they want. They have the hair that they want. They call you up, you give it to the makeup artist, and he went to work. Got hair done, gave her my paper, got my ponytail. It was like clockwork. Like, you know, you do not make any decisions when it comes to New York Fashion Week. All that is done there. They have complete control over how you will look, how you will walk, how you will dress, everything is done there. And it was like, it was amazing to see how all that comes together. They line you up according to what you're wearing. And so, you know, if you are wearing, you know, straight lingerie with just a top, the bra and underwear, then you would like, you know, you were in like different sections. And so I was wearing a special piece by a former model. And so we all had like lined up together. And so I was with my segment, and literally we're all in a straight line, and we're about to go on stage. And there were two women ahead of me. And I get up there, and Dana switched me, like literally like last minute switch. She looked at me, she like, I want you right here. So it was kind of off, but she had a vision, but it was kind of off from the audience because, you know, you're used to seeing like the different segments together. And she looked at me, and these were her exact words. She said, you go out there and you tear this shit up. And I was like, oh, okay, it's more pressure. Here I am on New York Fashion Week. I'm already a nervous wreck in front of all these people. I don't know who might be in the audience, and you're giving me the okay to go out there and just do me? So I go out there, and Lolita was like, well, yeah, but go out there but have them not expect it. Like you go out there, you do what I taught you to do, and then you give it to them. So I went out there and I modeled and I'm, doing what she taught me to do, chest out, right, your mind right, you're up and you're right, you're ready to go. And I go out there and I had my pink ponytail, which is a fun addition, and my pink eyelashes, had both of those. And all of a sudden, like, I don't know what overcame me. So I swung my pink hair this way and I turned around and I began to dance on New York Fashion Week. I followed the assignment. I followed my assignment and I did what was instructed of me to do.
The crowd was enjoying the show, but after she danced, it was a whole nother level of excitement.
To have your position in the audience to fly from Springfield to New York in the audience, that's pretty cool. Like, Dr. Summers is amazing. The fact that she made it her business to come to see me walk across that stage is amazing. So when I talk about having physicians who really care about you and really care about, what's happening, that's Dr. Summers. She didn't have to do that. She didn't have to make time to come to the East Coast to be there to support me, but she did. And she was so proud of me. Like, she didn't know I had it in me. She didn't know that I could do all that on the stage, but to have her there it meant the world. That was priceless. The next day I got a phone call. We're calling to set up your radiation appointments. I was just like I just got on New York Fashion Week. I just danced on New York Fashion Week. I had my moment, and then you call me and tell me about radiation.
Radiation affects people very differently. Some people can get can get almost a burn to the skin, which can be almost open wounds sometimes. Other people don't get a lot of burn. It's very dependent on the person. And then the other thing with radiation is that there can be changes to the breast over time, which continue to happen. So radiation, will affect the breast potentially for the rest of the person's life.
She wants to see me to make sure after I'm done, to make sure that everything is still aligned, that it's, how it looks how it's supposed to look. There are no continuous issues. So, that's the clinical side of it all after my treatment is done. But also on the other side is me advocating. I can't tell you how many speaking engagements I have received. So I have a due diligence now to make it my business to go out and spread the word, not only about breast cancer, but about breast reconstruction and making sure people know that they have that option.
Breast reconstruction for one person could be very different from another person. Their choices are very different, but they need to hear all the options so that they can make the best choice for them.
In the time of conquering, I had empowered myself. I had realized I had been saying this whole time about there's a rainbow in every storm. And then finally it clicked. I am the rainbow in the storm. I'm the rainbow that I was talking about. It's me. But it's okay because I'm going to shine through it and it's going to be all right.
You hold my every moment. You calm my raging sea. You walk with me through fire. You heal all my disease. I trust in you. I trust in you. Oh, I believe you're my healer. You're more than enough for me. Jesus, you're all I need. 'Cause nothing is impossible for you. Nothing is impossible. Nothing is impossible for you. You hold my world in your hands, and I believe you're my healer. I believe you're more than enough for me. 'Cause Jesus, you're all I need.